all of you are here on a Sunday evening, giving your valuable time to this important conversation. So I'm really very heartened to be here with all of you. Answering that question of why medicine. I'm reminded of this quote by Rumi, which says that what you are seeking is also seeking you. So while I would like to believe that I was seeking medicine, I would also like to have this faith that probably medicine was seeking me. As Sanika introduced that I was born and brought up in Mumbai, and I was born and brought up in a family which didn't have much of a background in education. Um, and That was therefore, an aspiration for any family which is dreaming about a future that their children become doctors, engineers. And so, and my name, my dead name or my previous name was Zakir Hussain, and therefore it was like always doctor would be added to it. And that's how it was like kind of predestined that if I get good marks, then I probably get into medicine. And it so happened that I did get good marks and therefore got into St. G.S. Medical College. And after that, it's all history. Um, One of the other, professions which I would have chosen if not being a doctor was a teacher. And then I'm very happy that now I have both the things. I'm a doctor as well as a teacher. So kind of both the boxes have gotten checked, and I'm very happy with the path that I have chosen because it helped me bring about changes from within the system and work with young folks and dream a future, which is more accepting, more inclusive, and more caring for people of all diverse forms. You are on mute, Amish.
I'm so sorry. That was actually inspiring to know that, yeah, the Rumi's quote made you come here, that, what is seeking you is also seeking us. That's beautiful, in fact. But I have a few more questions for you. And the first question is, in fact, a combination of two questions. And that would be that can you please elaborate on the specific health needs of transgender people in India? And what are some specific conditions, illnesses that are disproportionately prevalent among transgender individuals?
Right. Before we really start talking about the healthcare needs of trans people, I just want to kind of brush up or revise on who we are referring to, when we are talking about trans people, because for each one, the understanding can be very different. For most of us, we look at trans people probably at traffic signals, or, we have a perspective based on what we have seen in the movies. But when we are speaking about trans people here, we are basically talking about people whose gender identity of their own self is something different from the gender that was assigned to them on the basis of the sex. And when we say on the basis of the sex, it means on the basis of their sexual characteristics, predominantly the external genitalia. And therefore, trans people are those where, your gender identity and the gender assigned are different. And it's a broad umbrella term which includes transgender men, transgender women, non-binary folks who don't identify neither of the genders, gender queer people, um, or any other forms of gender diversity within the gender spectrum. Um, Now, when we speak about the healthcare needs of trans people, generally there's a lot of, I would say, exoticization which is done of trans healthcare needs, and with the focus being especially on what we call as sex change surgery or sex reassignment surgery. But trans people are like any other people, but also different, right? So, general healthcare or the primary healthcare that every one of us needs, when we have fever or something of that sort, is what all trans people also need, but find it difficult to access because there are barriers in the system. Um, in addition to this, they also have, needs of certain other healthcare services, like, for example, gender affirming services. So, trans people who want their bodies to be changed in order to fit their gender identity would need medical services like hormone replacement therapy or gender affirming surgical services or laser, etc. Also, living like a transgender person in a transphobic society is not easy, and that puts you under a lot of stress. And therefore, while most of us do need mental health care services, the risk of having a mental illness is much higher for trans people, and therefore, there's a huge need and also demand for mental health care services. Also, sometimes as a coping mechanism, trans people do use substances, and those harmful substance use, de-addiction, etc., is therefore another need. We also find that our, reproductive healthcare services are very binary. So for a trans man to, you know, go and seek treatment for menstrual disorders with a gynecologist can be extremely difficult. And therefore, there is a lot of unmet need also of reproductive health services. We also know that trans people do have a higher risk of sexually transmitted infections and HIV. In fact, it was the HIV pandemic that brought focus on the trans and MSM community previously. In addition, non-communicable diseases is, one area that has been often ignored, but is something for which trans people have a higher need or a higher risk, if I may put it that way. And that's because our NCD prevention and treatment policies have never focused on trans people. Like, for example, the cancer screening, when we speak about HPV vaccination, when we speak about cervical cancer screening, we don't take into consideration the need of a trans man who has a cervix to also, undergo pap smear, or for trans men who have a breast to undergo breast cancer screening, because breast cancer screening is only for women. So somewhere because of that systemic neglect within our screening guidelines, etc., there becomes a higher risk of NCDs, also use of hormones, etc. So those are, some of the broad areas where the healthcare need is really specific and higher for trans folks.
Thank you so much, ma'am, for in fact starting with brushing up our own basics regarding the transgender community and how bringing to our notice that mental health is obviously a challenge for all, but it is a much bigger challenge for the transgender community, and how we are facing a binary gender problem solution regarding how where transgender community is neglected in itself, and sensitizing us with all this information makes us more aware and much more of an advocate of future to bring forward much more inclusive changes in the system in itself. And we hope that in your lifetime we can bring it forward and you see those inclusive changes happening. Okay, coming to our next question to you: to what extent are the needs discussed in the previous question met? Okay. And can you discuss the social, physical, and mental barriers faced by transgender people, particularly in accessing healthcare services, and how these challenges impact their overall physical and mental health? Basically, that's a continuation of the same question where you touched upon different challenges. I would want you to dive in a bit deeper into so that we have a better understanding and so that we can look into much more inclusive solution towards it. Thank you.
So one thing that we need to understand is a bit of a history of trans people and their intersection with law and medicine. So trans people were never recognized by law, right? I mean, trans people have been in existence for thousands of years. They've been part of a culture. They've been around us. But somehow we were never legally recognized by the Indian law. And by Indian, I also mean the British law, which used to govern us. In fact, we were criminalized by the British government under the Criminal Tribes Act, which would criminalize eunuchs for cross dressing. Post independence, for nearly 65 years, the Indian constitution didn't recognize trans people's existence. It was only 10 years back when the Nalsa judgment of the Supreme Court of India came in 2014 that finally the law recognized that there are trans people also. There's a third gender also. And it also spoke about, the provision of equal health care to trans people. And that's how, subsequently the act legislation came, the Trans Act came, and the trans rules came, and even the government schemes started coming for trans people. We also need to recognize how was medicine progressing during that time. So again, in medicine, when we look at transgender people, um, For a very long period of time, it was considered a disorder, and it was classified as gender identity disorder. And something that we in medicine call a disorder, we look at a treatment for it. We try to fix it. So trans people were considered to be disordered or diseased for a very long period of time. Then trans people are not just having a gender identity but also a sexual orientation. They may engage in anal sex, etc., and therefore were also criminalized under the section 377 of IPC. And we also know that homosexuality was considered to be a mental illness for a very long period of time by mental health care professionals. And therefore, the entire attitude of the medical system or the healthcare system was to look at trans people as criminals, as people with mental illness, or as people with some kind of a disorder that needs to be fixed, or even perverts for that matter. Um, Now, from that to the change that we are looking at, where it is trans affirmative healthcare, it's naturally going to be a very long journey, and a lot of it has happened in the last 10 years since the law started recognizing trans people and started to ask that, come on, make those changes. So if you look at the needs of the trans people, even before the law recognized, trans people were getting these services. Like, for example, sex reassignment surgery has been on for as long as 50 years, right? And people have been traveling outside of India sometimes to get these surgeries. People have been on hormone replacement therapies, or they have their own cultural practices, like, for example, the genital surgeries, which were done as part of the Kinnar community. They have been practicing these procedures even if the medical system did not formally kind of recognize them. But in the last 10 years, there is an increased focus when for example, the Indian Psychiatric Society in the year 2007, 17 rather, came out with the position statement saying that trans people or gay people are not having a disease, right? It took nearly 50 years of gap between the American Psychiatric Society and the Indian Psychiatric Society for these position statements, but it happened. We have also seen now, like, for example, the National Medical Commission come and say that will not practice conversion therapy. It will be considered a professional misconduct. So finally, we see that, that the system is falling in place and it is creating an environment where trans patients are not treated as criminals or mentally disordered individuals. And now finally, with also the dynamics of a supply and demand system where there's also private medical system and doctors do need trans clients, we finally have some kind of a provision being made available in India for trans clients. So some of those needs are now being fulfilled within India itself, like, for example, the surgical services, the mental health care professionals, or even the gynecologists providing services. But the reality for majority, and by majority I mean more than 90% of the trans people, is that those needs are not fulfilled. And also we have to understand whose needs are getting fulfilled and whose are not. I don't have to be a very privileged, rich trans person to be able to access basic healthcare services respectfully and with dignity. So we have to really ask, has our government healthcare system started providing these services in a manner which is affordable, which is accessible to the community, and which is dignified and looks into the experiences of the trans persons themselves? So no, we aren't there. And when it comes to the barriers, I mean, even if those services are there and available, let's say, for example, the Fortis Hospital is providing those services, and I, as a trans person, have the money and the power, can I really still go and access it? And there are a lot of barriers which are within me that may stop me from doing. It may be a lot of self stigma, right? I may feel, oh, if I go there and tell the doctor that I'm a trans person, I may not be treated well. Or one of my trans persons had a bad experience with a doctor, and therefore I think it will be also happening to me. Or in my last experience, the doctor asked a lot of questions which are not relevant, and I don't want that experience to be repeated. So there's a lot of barrier within ourselves to access services, thinking I'll never be accepted there. Then there are, of course, societal barriers. You need to travel in the public transport to get to a hospital. You need to stand in a queue. You need to pass by the security persons. You need to get an OPD paper. You need to go to a pharmacist. There are so many things beyond doctors in the healthcare system that one has to navigate to get a healthcare service. And often these systems are not inclusive for queer folks. Similarly, if you look at the laws and the policies, some of the healthcare services, as I mentioned, are just not available to us by law. Like, for example, blood donation guidelines. So the blood donation guidelines explicitly say that trans people or men having sex with men cannot donate blood because higher risk of HIV, which is generalized for all trans people, and therefore they say that you can't just donate. Or, for example, surrogacy. By law, surrogacy is not available to trans people or to queer couples, or even the assisted reproductive techniques are not available. So there are a lot of these policy and legal barriers still in place, which don't allow us to seek all the healthcare services.
Thank you so much, ma'am, for bringing so much of information to our notice. And definitely, it is so unfortunate that it took 50 years for our Indian Psychiatric Society to come, like, to accept that transgender isn't a disease, and we have to accept them. We need to be inclusive. Although you did mention about how our system is falling in place slowly, but it is taking a lot of time, and there are so many discriminatory factors and mental challenges which is inside ourselves and sometimes in the societal factors which we still need to deal with. But we hope that we take those smaller steps and get to the position where we can say that we are an equal society for all. But at the same time, since you were mentioned about legalities and everything, I have the same question, the next question to you regarding the same, that in addition to the unmet healthcare needs, how do societal attitudes and discriminatory legal policies affect the overall quality of life for transgender people? Like, yes, we have changed a few laws in India, but do you feel that there can be much more legal prospects to it, which India uh, and the Indian people need to go to the government and ask for and advocate for so that the change is done?
For any marginalized community to be integrated or to be mainstreamed into the larger society, you need good policies, you need good laws, and there are parallels. For example, like, if you want the Dalit community, which has been systematically marginalized, oppressed for centuries, to be mainstreamed, then I need a law which says that to do discrimination against a Dalit person is going to be a crime, right? Um, Similarly, if we look at persons with disability, another marginalized group, I need a law which says that, okay, these are your rights. Okay. Um, Now, we do have, for example, laws for Dalit community. We do have a law for persons with disability, the rights of persons with disability. And we did get a law for trans people in 2019, what is called as Transgender Persons Act. And that act also says that if you discriminate against a trans person in any form, then it's an offense and one can be punished for 6 months to 2 years. But the law which was made in 2019 and the rules which were made, they were made during the COVID-19 pandemic times with very poor consultation. And a lot of community members don't like this act, to be very honest. To give an example, how even though the act is there, but it does not help in some cases, or rather minimizes our existence, is the punishment for sexual assault. Um, when we look at the rape laws, that the rape laws are only available to those whose legal ID is a woman. In India, men cannot be raped, or transgender people cannot be raped. Um, Then we have, of course, the section 377 of the IPC, which says that unnatural sexual offenses, and that is for everyone. We have POXO Act for children below 18 years of age. We also have, if you assault an animal, again, under section 377, and for all of them, the punishment ranges for around 10 years to even life and death penalty also. But for transgender people, remember, trans people who have an ID as a trans person and not as a woman, they can only avail the Trans Persons Act provision, and that says only up to 2 years of punishment, which means that it is lesser than the sexual assault for an animal, which can land you in prison for 10 years. And that's, kind of reduces the existence of trans people below even the level of the animals, though I have huge respect for animals, and I do believe that 10 years should be what's there for animals, also because they can't give consent. But then to say that for trans people it will be only 2 years, and again something for which you need a preliminary investigation before an FIR will be filed, is dehumanizing. Similarly, to say that if one wants to change the gender from male to female, then they have to undergo a surgical procedure, or from female to male to undergo a surgical procedure, is extremely unscientific and also illogical. And I'll explain it why. For most of the trans men, that means those who were assigned female at birth and now want to change as a male, the bottom surgery is what we call as where they undergo hysterectomy and oophorectomy and then the creation of a phallus. Is especially the phallus creation part is, most of these surgical services are not available in India, and even if they are available, they're extremely expensive, um, also risky. And therefore, to say to someone that if you want a change in your legal ID, then you need to risk your life to undergo that change is not acceptable at all. But then the law was made like that. So while the law came, it has a lot of deficiencies. And as I was saying, along with that also came other laws which took away the rights which were previously available to trans people, like the right to undergo surrogacy, the right to commission assisted reproductive techniques, or for other fertility preservation methods. And even the adoption related laws can be extremely discriminatory. So while the laws may be there, they aren't sufficient. And if I look at the larger LGBTQIA plus community, then homophobia is not a crime in India. I mean, you can be homophobic openly and still you cannot be punished under any law, right? So there's no law for that. You can be bullied in the school for being queer, and if the offender is below 18 years of age, they cannot be punished, right? So there are many of these provisions which are there. Similarly, at workplace harassment, we know that the workplace harassment laws are meant for women only. The complainant can be woman. So if a trans person complains under workplace harassment, they don't have a provision under the law. So there's still a lot of lacunae which are present. And second thing that I want to say is that, for any mainstreaming, you need law, but you also need societal changes. You need societal acceptance. I'm happy to say that for trans people, the societal acceptance is growing. We have a lot of media representation now of trans people. We have a lot of success stories. Most of us do know of one or two trans people around. We've seen them, our families have seen them. So somewhere the conversation is growing, the acceptance is growing. But for most of the trans people, what matters is the acceptance from the close family. Even if the entire society becomes accepting of trans people, but your parents don't become accepting of you, it is not enough, right? And it's currently we do not have any kind of service or provision available where the parents can be counseled, where the family members can be counseled, because it's also a difficult journey for them, right? They have to also accept the new reality of the child. And especially when it comes to transgender children and adolescents who are below 18 years of age, our healthcare system, our legal system has miserably failed them. Our school systems don't have any kind of counseling for teachers, for parents to how to raise a trans child, or how not this child should be bullied, or any kind of provisions which are gender inclusive for this child. And the same continues, till the child keeps growing and enters college and university. So those are, two important aspects: law and society. Changes are happening, but I think there's still a very long way to go.
Uh, is Yashika audible to everyone? Yashika,
Hello.
you're not audible. Okay, I'll follow up.
Yeah.
So thank you so much, ma'am, again. Yeah, you did mention about how we have a certain legal policies and legal laws in India, but those laws are definitely not enough. And it really touched my heart that that even there is a growing acceptance regarding transgender community in India. How if there is no acceptance in our own family, it still hurts a lot. And that is where mental health counseling, and that is where a lot of challenges come in, which we need to take and cater to. And that's a lot of key takeaways in this part. Let me just move on to the next question for you. So, what are some of the guidelines we should be aware of while providing inclusive services in specialty areas such as mental health, sexual and reproductive health, and medical transition procedures? With respect to all these specialities and how they connect with the transgender community, we would like to know what could be the specific guidelines which we should be catering to, we should be asking for in such scenarios. Thank you.
That's a very that's going to be a very long answer, but I don't want to delve too much into that because then we'll not be able to discuss other things. Maybe someday we can have a webinar where we look at case-based scenarios into those specific situations and how we can deal with those things. But some just basic um, rules that every one of us can follow is first and foremost, we are all human beings. We all have biases. Some of us, our biases are explicit, some of them are implicit. I think it's very important as healthcare professionals to look at our biases, first of all. And I'm not talking only about queer persons, it's about any community or any kind of marginalized group or person. Because just having skills or knowledge is not enough. At the end, what matters is also your attitude, your communication, your empathy towards the patient. And it's important to, first of all, be consciously aware of our own biases. And then not to allow those biases to hamper the services that we are providing. You may not principally agree with something, but still, you know that my client has a right to a service which is competent and which is dignified, and I must provide that. We have often had, these kind of situations where people say, "Oh, I don't accept homosexuality, and therefore, why should I be providing services to someone who is a gay person?" Or, for example, I am an anti-abortion person. I believe in the right of the child. Then how can I provide abortion services? And so on and so forth. We need to one understand is that when we work as doctors, we work under a framework of law. So there is some duty, there are also some rights that we have as medical professionals. So one has to be conscious that I'm fulfilling my duties as a medical professional, being cognizant of my rights also. Second is, even if you're providing service to a criminal or a prisoner, that is one aspect of their identity. But when they come to us as a patient, we just forget that they're a prisoner or a criminal and we provide them services that they need. Similarly, if you think someone, their idea or their lifestyle or whatever their activity may be, it doesn't match with yours, it's absolutely fine. Here you are in a relationship of a doctor and a patient, and therefore that is what your focus should be. Having said that, that is the most basic that you can do. And of course, on the spectrum, then as you rise, you can also become advocates for the rights of your patients and for the marginalized groups. That's of course the higher, level that we are looking at. Second important thing is, do not assume but ask. That's a very important principle, especially with queer folks, with trans people. There's often a lot of curiosity that doctors have towards their bodies, towards their sexual activities, towards, their family relationships and so on. And often the conversation shifts from the illness at hand to these aspects, which can be extremely triggering and disturbing for the patient. So one important thing is do not let your curiosity kill the cat, right? I mean, um, don't be curious unnecessarily, but at the same time, do not stop yourself from asking the questions which you need to ask for providing the right care to the person. So one has to achieve that balance between getting to know enough, but at the same time, not being overtly curious and asking questions which are not needed. At the same time, one has to also be, like ask and not assume. Um, but at the same time, while asking, don't be too curious. So again, that's a balance that needs. I'll give you an example of what I mean by ask and not assume. So when a trans woman goes to a doctor and their ID is woman, say, okay, she's a woman. and I start providing services to her as a woman. Then I forget that she is a transgender woman and would also have a prostate. I forget that she's a transgender woman and is not having a uterus, is not having a cervix. So while we look at the gender identity of a person, we have to also look at the bodies. And therefore, there is something that we say is an organ checklist that we look at in the trans people. That we say, okay, she's a trans woman who has a prostate, who does not have a uterus, who does not have an ovary. We have a trans man, and this is a trans man who has a uterus. This is a trans man who has ovaries. The trans man who does not have prostate. This is a trans man who has breast, right? So that helps in their providing services which they need without reducing them to their biology, right? So we treat them as a man, we give them all the respect and identity as a man, but at the same time, we know that they have a cervix and therefore they need cervical cancer screening also, right? Um, Third important thing is the terminology, you know. So how can we make a language which is gender affirming? Like for example, in trans men, they don't like referring to their breasts as breast. They would want it to be called as a chest wall, um, or something of that sort. Similarly, for trans men, they wouldn't want their genital opening to be called a vagina. So we use the word genital opening. So you have to look at what are the words that the client is comfortable with, what are the words that are acceptable to them without unnecessarily creating a lot of dysphoria in them. Fourth very important thing is to respect their chosen name and pronouns, even if the chosen name is not there on the legal ID. So I may say that, okay, my legal name is something different, but my chosen name is Aksa, and I want my doctor to call me by that name. Then what's the harm in calling me by that name? On the medical records, you may write my legal name. That's fine. But while conversing with me, if you can choose the name that I like to be called with, then that can change a lot of communication. Similarly, my pronouns, respecting the pronouns and don't assume the pronouns of trans people on the basis of their looks. So if they look masculine, I'll use he. If they look feminine, I will use she. Nothing of that sort. You just find out what are the pronouns. And one important way of asking for pronouns is to say that these are my pronouns so that the client, if comfortable, can tell you the pronouns or you can see how they refer to themselves and then use those pronouns. Another important aspect in providing service is confidentiality. A lot of trans people need that kind of confidentiality. They may not be out to their parents, to their family members, to even their partners at times. And therefore, while providing services, we have to be, sure that we take that into consideration. Um, Respecting their chosen families. Sometimes the next of the kin may not be their biological family, but the chosen family. So, how, while staying within the law, we can also respect that is something that we can look into. So, those are, just some small basic things that we can apply everywhere in our healthcare provision and ensure that it creates a safe and inclusive environment for gender diverse people.
Sorry. So thank you, ma'am, for answering us and enlightening us on the policies, the pronounces, and other terminologies. I would like to ask question on the medical education system. So with the introduction of the new curriculum, that is CBME pattern, as we all know, we are more oriented, towards the patients, like, having conversation, going out in the community and speaking about it. So I wanted to know what are your views on the need of introduction of inclusive care in the medical curriculum.
Thank you. That's a question which is very close to my heart. And that's currently also my current area of work. So, when I joined my medical education system in 2000s, that was a time when being a trans person was considered as a disorder, was considered as a crime, and so on. A lot of, time has changed since then. And now we know that the National Medical Commission, under the order of the Madras High Court, has started to change the curriculum. So they've changed the curriculum in psychiatry and in forensic medicine to ensure that some of the transphobic content is removed and the trans affirmative content is added to the curriculum. But unfortunately, we should not reduce trans people to only forensic medicine and psychiatry. I mean, what about other subjects, right? So while the start was made with two subjects, there's still a lot to be done, and the entire medical curriculum needs to be revised, and not just in the undergraduate level, but also in the postgraduate level. So, for example, they did introduce some competencies in the postgraduate curriculum of physiology. But again, all the subjects that touch lives of trans people need a change, and we need an overall change also in the way we look at trans people. As you correctly mentioned, it's not just about the medical subjects, but also attitude, communication, etc. Um, and we believe that that change will not come on its own. We'll have to bring that change. So one of the work that we are doing is to propose to National Medical Commission that these are a set of competencies that you need to include in the medical education to ensure that the next batch of doctors who come are prepared to care for trans people better. And we did create those competencies by having consultations with the trans people themselves, with medical educators, with doctors who are providing services to trans people, and also with the activists who are working for rights of trans persons. So that it comes from the community and then goes to the healthcare providers. And we have been also conducting workshops in various medical colleges to train doctors on those competencies, because we believe that National Medical Commission will take its own sweet time. We know how the medical education system works in our country. And my apologies for all the PG entrant examination goers, who had a sudden shock last night. Sorry about that, but this is how our system works, right? So we are not waiting for the system to change. We are like, okay, the medical educators are here. We want to learn. Let's start having a conversation on that. And I have personally visited more than 20 medical colleges and interacted with faculty members, students, etc. To talk about the subject of trans inclusion in the healthcare. And it always warms my heart that the young medical students are the ones who are so open to the idea, who are so keen on learning, who are um, keen on discussing. Of course, the older folks in the medical education system would take their time to come around. But I think the younger medical students are the ones who give me a lot of hope. And I'm really happy that I'm part of this conversation today, also with the young medicos online. And thank you for taking this important topic for conversation.
Thank you so much, ma'am. And we are actually so glad to know that you are taking that proactive front into making our own medical education system so much more inclusive, and to making us realize that there is much more beyond a binary world, and we need to take and cater to all the population we have, with all the respect they always deserved. And on the similar line, since you mentioned that it's from community, it goes to the healthcare providers as well, and you go on to the public and give them workshops and a lot of other methodologies to work towards an inclusivity program. My question lies in the similar line, like what strategies can be employed to design public health campaigns that effectively address and meet the needs of the transgender community? Basically, whatever workshops and other methodologies you were talking about, we would like to know something more in detail about them, so that if it is possible for us to, we would also like to conduct them. So to make a more inclusive environment around us.
So I want to address that question in two parts. One, of course, being the public health aspect, and me being a teacher of community medicine. That's, of course, my area of work. Um, you know, um, so one is that there is a legal mandate to provide services to trans people. That's there. It's the duty of the government to provide those services. We know it's a marginalized group. And on that behalf, certain things need to be done by the government as part of the public healthcare system. One, of course, the Ayushman Bharat the insurance scheme for trans people was launched in 2022, but it's not been implemented, and we are in 2024 mid now. It's been 1.5 years, nothing has moved. Um, Second is, the guidelines. We are still wanting the government to come with the guidelines for blood donation change, guidelines for providing cancer screenings, guidelines for providing vaccination to transgender people. And somehow in those public health avenues, the things have not yet moved. Another important aspect of public health, of course, is the medical education system. It's also sensitizing the entire healthcare delivery system, whether it is at the PHC level, secondary level, tertiary level. And one important aspect in that is the provision of trans inclusive services across India in the government hospitals. So the governments were asked to ensure that trans people can be admitted respectfully, and therefore to provide separate wards even if required. That hasn't happened, right? Um, Similarly, when it comes to documentation, we now know that the law recognizes three genders now, and but when you look at our medical intake forms, we still have the binary there. Another very important aspect, and that is something I would want young students to really discuss on, is the issue of intersex children and intersex adolescents. So intersex are those whose sex characteristics are such that you can't put them either into male or female. But our law and society does not really accept the third sex possibility. And therefore, a lot of surgeries and procedures get done on intersex children when they can't consent, when they can't even understand. And it is not for their betterment. It is for the parents to feel relieved that, oh, they have either a boy or a girl child. The government is still to make policy on performing surgeries on intersex children in such a way that it is in their best interest and not the interest of their family. So a lot needs to be done on the public health aspects. And I think one very important aspect of that is to also increase the funding on healthcare in general and also for marginalized groups. Coming to the second aspect that you alluded to, that is in terms of how we can do more sensitization with medical students, with medicos, with educators, and all. Um, I think what is needed is, for it to become part of a formal curriculum. We all come from medical schools, and we know that it's an extremely packed schedule as of now, and the colleges and teachers only follow what the NMC says. Um, So we have to somehow find ways, innovative ways in how it can be integrated in the existing curriculum. Like, for example, I see you have a family adoption program, right, which recently got introduced. When you look at families, do you only look at cisgender families? Do you only look at heterosexual families? Has anyone ever thought that let me go and study the transgender families and communities who are staying? Aren't they also in the need of adoption by a medical college, right? But we never go there. So somewhere in the existing curriculum and scope of our education itself, if we can integrate, trans inclusivity, then that would be something more feasible to do because already the schedule is so packed. And when it comes to medical students, now we do have a lot of colleges which have queer clubs, which also focus on trans inclusivity. And I think these are excellent places to have conversations, which are not just medical in nature, but also ingrained on human right aspect of being a queer medical student or a trans medical student. Um, I'm very happy to share that now there are at least 30 plus doctors who are trans identifying, who are out and proud there, and a very high number of medical students who are also coming out, as gender diverse or trans people. And this is a very promising situation because just 10 years back, that number could be counted on fingers. Um, so I'm very hopeful for the future of trans medical students and doctors in our country. And I think, the role of queer clubs, etc., is quite great in ensuring that they find a safe space to study and become doctors.
Okay, thank you, ma'am. That was really a lot of knowledge to take back home today. So I would like to ask next question. What strategies can be implemented to reduce the incidence of violence against the transgender individuals?
Can you please repeat the question? It wasn't very audible.
Can someone confirm if I'm audible right now?
You are audible.
Thank you. Sorry,
Your
ma'am.
voice cracked for a minute, but you're audible.
Okay, thank you, Sanika, for confirming. I'll repeat the question, ma'am. So my question goes like, what strategies can be implemented to reduce the incidence of violence against the transgender individuals?
Uh, that's uh, that's again a very big topic to answer on. Um, when we look at violence against any marginalized community, we need to understand that there are many factors at play, social factors, familial factors, etc. I would like to still keep this more towards medical violences or related to the healthcare violence. And I think the most disturbing part of it is that a lot of this violence happens within your natal families, um, by your own people, by own family members. And one important aspect of that violence is conversion therapy. So conversion therapy is where people have some kind of a medical, surgical, hormonal, or psychological procedure to change the sexual orientation and gender forcibly of a person. This was legitimately practiced by psychiatry for decades, until very recently, when the Psychiatric Society said that it cannot be treated, it should not be treated. And then, of course, the Madras High Court came out with its order saying that conversion therapy should not be practiced, followed by NMC issuing its order. But the problem is that these orders are often on paper, and a lot of conversion therapy still keeps happening in our society. Some of these conversion therapies can include giving electric shocks to people, it can include sexual violence against people, it can include giving them certain medications also, which don't work, and of course do more harm not just to the body but also to the psyche of the person. Um, Another important aspect of violence, as I was mentioning, is the violence against children who are intersex, where in the form of sex normalizing surgeries, they undergo surgical procedures which can be scarring, which can be traumatic, which can have long-term consequences in the form of strictures. And these are done without your knowledge or consent. And therefore, when you grow up and realize that you have been operated upon on your childhood for a thing that didn't need to be operated upon, that's very traumatic. And it is something similar to female genital mutilation, which across the world, we agree is an inhuman practice. Then there's a lot of violence that can happen when providing or denying medical procedures. There are numerous instances of trans people visiting doctors or other kind of healthcare professionals, and in the process being subjected to either denial of service or the provision of the service, but then some other form of violence accompanying it, sometimes including sexual assault by the healthcare providers, which is just totally unacceptable, especially when it's also happening to people below 18 years of age. Um, so I think, as I was mentioning, you need a strong deterrent in the form of a law to stop such instances of violence and of transphobia against a marginalized group. We do have a law, but it does not have enough teeth right now, and that's what we need to work on towards the amendment of it. Plus, also the medical professional bodies need to be more stringent with its own members. Like for example, NMC said that if you do conversion therapy, you will lose medical license. It's been 2 years, not a single person has been tried under that provision. Does that mean that we don't have conversion therapy happening in our country? You all know the answer, right?
Thank you so much, ma'am. We know that we have asked you like such a big question, and but you were able to summarize it so beautifully for us. And Aksa, ma'am, we know that we have been bombarding you with so many more questions, but one last question for this webinar, and that is, we have been asking you very India-specific questions, right? Now, one global question for you, that how do healthcare systems in different countries compare in terms of transgender inclusivity?
Yeah. So, there's as much diversity in international healthcare provision as much as in trans community itself. Um, so while you have some examples of certain European countries which do provide more trans affirming healthcare, or of certain countries, some states within United States which do provide more trans affirming care. I think what is good about Indian part is that we have a strong law which says that that trans people are there, and we are one of the few countries in the world which have a law that recognizes trans people's identity. In many countries across the world, trans people are not even legally recognized, and if you are not legally recognized, then provision of any form of healthcare becomes very difficult. In some of the countries, you have much more advanced healthcare system, more inclusive, where even trans children are provided services. But at the same time, we should be also aware of the backlash that can come when more progress happens, when it's more out there and in your face at times, the backlash can also increase. So you will see that, I'm sure most of you are aware about how there has been regression in case of certain rights in United States. Like, for example, abortion rights are not available to many people in some states of US. Or, for example, even the trans bathroom laws, there are more laws that are stopping trans people from entering women's washrooms as compared to the laws that help trans people gain certain rights. Or, for example, certain laws in the Europe right now, for example, in EU, which say that you can't provide services to children. So while there is, in general, I would say more awareness and more inclusivity and more provision for healthcare of trans people, there is also, places where there is a backlash happening or where we are going two steps backwards. And while we take these best practices from the world and adopt them to our Indian scenario, it's important to look at our specific Indian culture and scenario before we adopt those changes. So we often say that just can't copy paste, the standards which are available in Western healthcare for trans people in India, because in India it has a specific cultural and social aspect to it. Like, for example, in the West, before you undergo surgery, they want you to live in your desired gender for 1 year. Now, in a country like India, where if you dress as something else and go out in public, it can also incite violence against you. This is not a recommendation which I can really fulfill. So one has to like tailor make it according to us. I can't really ask them to get certificate from three psychiatrists, knowing that even getting one psychiatrist in a rural area can be difficult, right? So one has to look at those aspects and then tailor make it to the Indian reality. So, and there are many good examples from India of the work being done for trans affirmative healthcare. And I think the world also has a lot to learn from us in that aspect.
Um, am I audible? Can someone please confirm once?
Yes, you are.
Okay, so I think that's it for the questions from our side, ma'am. I would like to conclude by saying thank you, ma'am, for such an amazing session, and it is a privilege to have you with us for this webinar on such a crucial topic. And we have a lot to take home from today's session, definitely. And this has given us an insight within the transgender community and the medical community, which will be really helpful for us as a future healthcare providers. Thank you once again to have taken out your precious time and joining us on a Sunday evening. Apologies for any mistakes in our language, and together let's make a safe space for all. Thank you. Also, for the participants, we will be sending the post event link on the group chat only, which is mandatory for the certification. So, yeah, participants, please wait for the link. Thank you so much.
Thank you, team. And it was my pleasure to be here with all of you. Have a nice
Thank
evening. Yeah.
Thank you
Thank
so
you.
much, ma'am.
Bye.
The post-event questionnaire will also contain a feedback question, so please ensure you give all your feedback in that question.